Well, it was recording up until the phone call, right?
Yeah, it was.
Yeah.
So it seems like lack of social support is is a problem for many patients.
Yes.
Who do you think finds out? So you think Margaret and Julie, the nurse navigators, are the ones who find out about they sort of, is what you were describing seem more like how they find out about lack of social support. Like, they identify people who seem like they will have lots of challenges.
Or on the alternative side, it's like this guy's mom has called 3 times wondering if we can get a sooner appointment with Dr. Day. And then I talked to his sister and the referring physician. So then sometimes it's on the opposite end of the spectrum, whereas
they're like extra
diligent.
Not so much extra supported, but extra needy and on top of things.
Yes.
Which I guess are sort of different. They're sort of different things to measure.
Yeah.
Like support and on top of itness. But generally people who lack support are also not on top of it.
Yeah.
So how do we find out what support does exist, or like how to marshal resources for them, or like help them? Like, we've identified that, like, you don't have a car, you don't have any family members, like, and you live 200 miles away. Like, how do we help? What information do we do to figure out, like, how to actually turn those problems into not problems? To be like, oh yeah, well, we did hear that you're, like, super religious, like, did you talk to your church, or did you talk to the American Cancer Society, or did you know that there was a Medicare van, or gas money from the Head Cancer Alliance, or a variety of other ways that, like, people can get supported? I don't really have insight into how we like inventory support and then marshal it to be helpful for people.
I think we just kind of figure it out as we go. I mean,
I think the nurses are probably most in touch with like this stuff.
Yeah.
And it probably goes.
I think after y'all like leave the room and then we're coming in to like discuss like, so I'm gonna set up 800 million appointments for you.
Yeah.
And they're like, I don't have a car, and today I like hitchhiked my way here.
Yeah.
There was one guy who literally sold cans to get money. He like each can that he found in trash cans.
The aluminum cans,
Yeah, to get here. That's how he got here one time.
So did someone tell him there's like gas card programs?
He was homeless and just kind of disappeared off the face of the earth.
Okay.
Yeah.
So he's extra hard to. That's extra challenging.
But so no, then I think Sandra and myself, or Julie, when she goes in after new patients and kind of like does her spiel, between the 3 of us, figure out what kind of resources they have. And if it's insurance, like Medicaid, Medicare, can they take logistic care? You know, do you have any family members?
Do you think like revisiting that topic somewhere like in the hospital or after discharge would be helpful? Like, I feel like to just sort of like renew the conversation and restock about like the adjuvant therapy plan, because I feel like a lot of that's like basically to get you to surgery.
Yes.
Which is unfortunately only half of their treatment.
Yes, you're right.
Do you think that discussion ever happens again afterwards?
No, I think it does, because then when they're inpatient and nobody comes to visit them and they're going to be discharged with the trach and wound care, who's going to be doing it, and you realize the patient can't.
Yeah.
Is when you start on the back end kind of scrambling to figure out then at that point.
So you think the inpatient side helps a little bit with support, mostly vis-a-vis wound care, but not the logistics of like how you get to your appointments? And
no, I think the inpatient people are dealing more with who can learn how to care for your trach, your peg, and your wound.
Okay.
Not like logistical kind of transport back and forth stuff.
Okay. What would your thoughts be on someone who, like, so it seems like Julie mostly navigates into the system, and then after that people sort of like are on their own. Having someone like her like help get people through that second like gap of treatment. Do you think that person would be helpful, not helpful? Like, how would they help?
I think that would be helpful.
How would they help?
So Cheryl was kind of like a bridge there, but now it's just fallen on. Well, so now that Cheryl's not here, it's kind of all of our shared responsibility to get patient through, the post-op period and into treatment.
Yeah. Do you think people have like clear roles? Like, do people are like, that's my job, that's your job, or like?
No, it's all shared.
Yeah.
Yeah.
In a way that is not well defined. Like people are like, I thought you were doing that. Like, you didn't do that? I thought you were like.
Yeah, a little bit. Yeah.
Okay, so some like gaps where stuff's not done, and then some is there like redundancy where 2 people did the same thing?
No, it's generally like somebody discovers it wasn't done. Yeah.
Okay.
Yeah.
Just through their perseverance.
Yeah.
Okay. Okay. Calendar with date. I'll just have to make that up on my own. So do you think? I think that covered pretty much everything we needed to cover. Oh, teeth. You said teeth. You thought used to be a problem, but not so much anymore. So where do you perceive now as like? That, I mean, do you catch any back discussions on the backside where like they've left the hospital and their teeth are still in place, and they come to their first post-op visit, and now you're talking about dental care with listen to a conversation about dental extractions?
It's usually when they're not getting treatment here. So
Yeah.
like if it's on someone's radar, like Sharma, to get that arranged, like it's on his thought process of getting someone ready.
Yeah.
Or Tamara.
Yeah.
It's usually when they come back for their post-op visit,
Yeah.
and probably it's the patients who saw Sharma pre-op
Yeah.
knew they were going to have something done locally, not here, and
Yeah.
then so it's like, okay, well you're off my radar then. And then they come back post-op and nobody had addressed teeth.
Okay, because it seems like most people see Tucker and Davis.
I think we've gotten much better at it.
Okay.
The first year I was here, I felt like that happened a lot. And
Where-
then they come back and you're like...
And so the problem was that they
teeth.
didn't see the problem was they didn't see Tucker or Davis.
Correct.
Or they saw
They saw Tucker or Davis that
Yeah.
first day. This
Yeah.
is another reason why I don't like Dr. Day sending them to everybody all
Yeah.
like the first day that they come, is because you don't really know what the plan is often
Okay.
from that immediate first visit with him. So he'll send them over there like, oh yeah, I want you to meet my dental people, and they're like, I don't know what the plan is yet.
Yeah.
Like exactly where are you radiating? I don't know which teeth I'm going to need to have extracted.
Okay.
And so then they'll get everything goes to surgery, gets set up. They go to their like
So no one ever like comes back to close the loop. Like once
No.
the answer is known, that they're like having surgery and adjuvant, and these would be the relevant teeth. Like that information doesn't make it back
correct.
to the teeth pullers.
Yes.
Okay.
Because Tucker sometimes, I mean, he's like, sure, I'll see him, but like, I mean, it's just like a meet and greet essentially. Like,
Yeah.
here's gonna be my role, and if you have this, I'm gonna do this. If you have that, I'll do that.
Okay. So it's not like
And then you're like, check. We got
Okay.
them to go over to maxillofacial, and then it's like off everybody's radar.
got it.
Yeah.
Okay. And then what about the maxillofacial oral surgery interactions? Like the people who designate which teeth come out aren't actually the people who take the teeth out.
Correct. That's pretty annoying.
Okay. So is your understanding of what's supposed to happen?
Well, I've heard that that's become a bigger issue because the oral surgery guys have gotten like mad a couple of times as
Okay.
of late,
Okay.
which maybe
Mad about what?
about not knowing when an OR date is or whatever,
Oh.
and then actually pulling a patient back or prior to surgery to
Yeah.
pull their teeth
Yeah.
and making them have two different surgeries, which just seems
So they
cruel.
not do the surgery not do the
They
teeth on the
won't-
day of
They
surgery.
won't pull the teeth the day of surgery because nobody communicated well with them. I've heard that happen like on 2 or 3 patients recently.
Okay.
I don't know which oral surgery guy it was, but one of them was being kind of a jerk.
Okay.
So my understanding is you send them over there. If Tucker or Davis know the plan, then they're
Yeah.
going to arrange with oral surgery.
Okay.
They take care of it.
Okay. So they send them to the oral surgeon.
Yes.
Okay.
Lately, we've been doing both an oral surgery appointment and maxillofacial.
You make them.
Yes, I'll put that in my referrals as part
Okay.
of all of my referrals.
And they leave for that one day.
Yes.
Okay. I catch you mostly on the backside, so like as the recon where like everything else happens.
Mhm.
On the busy days that you describe, like how is that all set up? Like so they see someone and sees them at 8. Like is the rest of the day all set up already? Do
No.
they already have like okay?
No.
So Day sees them and then they have a separate day with like
Yes.
8 appointments.
Yes.
Okay, it's not the first day they see him.
He likes for a lot of stuff to happen that first day
Yeah.
after he sees them, but I don't like that because
Okay.
I feel like stuff gets.
Is that day set up ahead of time then?
No, it's not. It's like he comes out of a room and he's like, "Can we see if speech can see them?" But like still unclear. Like they have yet to get, like the PET scan wasn't a good read or whatever. He wants to repeat the PET, present them at tumor board, and nobody really knows exactly what a plan is. And he's like, "Let's get speech to see them, and why don't they go over and see Tucker and Davis while they're here?" And you're like, "Ugh,
Okay.
they're gonna have to come back anyways."
Okay.
But he has that multidisciplinary kind of team thing in his head that he's like super proud of. So
Okay.
he likes.
Why doesn't he just schedule all the appointments ahead of time though? Like if they want to multi-D, like why wait till he walks out of the room to say like teeth?
I guess because sometimes you never really know.
Okay.
Like Margaret Ann is not clinical,
Yeah.
so when she's getting these referrals, she wouldn't necessarily know what would need to be set up. You know what I
Okay.
mean? Although she's very smart and she's
Yeah.
very good, she isn't
Yeah.
clinical.
Okay.
So Julie might be able to like sometimes catch things like, oh well, he's totally gonna need to see speech. He's gonna need a TL, so she'll like go ahead and throw that on the books. But that's kind of just hit or miss.
Okay.
Yeah.
But I think there's a probably a core set that probably, like you said, they make it to everyone. Like pretty much everyone sees like speech, dental.
Yeah.
And then if you're doing radiation medical oncology, like everyone just sees.
Yes.
Everyone.
Yeah. Yeah.
Short of it. Okay, but that's not.
Speech as of late has also been short, and I have a really hard time getting them healthy.
Yeah. Just
especially on Fridays.
Yeah. Okay. Okay. Do you have any things that you think are important that I didn't talk about for like, what are the challenges that people face from like the time they have their surgery to start their radiation? That's like an issue to be somehow addressed that you perceive.
No, not that I can think of.
Okay. Do you have any suggestions for like how we should? Can you, how would you go about tackling these like many different problems we've identified?
Well, they no. So now that Sharon's gone, that position could be like utilized really well. Exactly how?
Yeah.
I don't really know that. So the inpatient NP, I think, was like a problem specific just to Cheryl because she had worked over there, and so she was still like being utilized in an inefficient manner.
Yeah.
So I think that role could be, if we got the right person in it and had a clear, defined like orientation as to what they're going to be doing and their expectations, which I think is also a problem.
Yeah.
With Dr. Day does not spell this out for people.
People's like roles and responsibilities aren't clearly defined.
No.
Okay.
And even when they go outside of their roles or responsibilities or don't fulfill their roles or responsibilities, he will not like ever confront anybody or call them out on it.
Oh, right.
So even when I feel like we presented him with stuff that like this is a problem, it's just ignored.
So I think having an inpatient person would really help get the initial like surgery to back to the outpatient world and potentially out to other hospital systems. But I worry that they would like once they make it to that first post-op appointment, like is that inpatient person really going to care? That are they going to check to know that they didn't go to their radiation appointment in Greenville? Like probably not.
So Caitlin tossed around the idea before Sharon left that Sharon be kind of whoever was in that role be responsible for like staying on top of when Path came back, setting up those referrals, making sure that people got to them, etc. And that like specifically being their like kind of only role.
Yeah. So someone who navigates. Yeah. Between.
But would be more on the outpatient side.
Right.
Because I think you're right. The inpatient side is just kind of going to get lost on this end.
Yeah. But if they basically have to pick up. They basically pick up like when you're about to like they pick up before you leave the hospital, so you're not like actually lost. Yeah. And then navigate through.
Yeah. So if someone on the outpatient side kind of had that role, I think they'd be able to stay on top of these people better.
Yeah, an outpatient person who like went to pick them up before they left.
Yes.
The inpatient side.
Yes, exactly. Yeah.
Okay.
But other than that,
do you think they would mostly handle, like the social challenges, the like care coordination challenges? Like where do you think they would spend their efforts?
Well, we only have one social worker for all of Hollings, which I think is ridiculous.
Okay.
And she's amazing. It's Krista Schaff, who we used to have on 7 West. Before her was some other woman that was awful.
Okay.
So even having a good social worker, it's only one, which I think is ridiculous.
Okay.
For oncology patients.
Yeah.
So I think if you had a social worker that you could like reach out to often and like who was part of our team, that would help a lot with
these sorts of things.
Yeah.
Okay. So you think part of it would be social work, and then what about all these like care calling for appointments, making sure you get appointments, like making the right referrals, like picking radiation facility? You think they would do that stuff? Just check to make sure that other people did that stuff?
So if you had that one designated like outpatient person whose kind of like role was dealing with that kind of stuff, I think that would be helpful. With the system part.
Yeah, they'd help. They would help make sure that the system does what it's supposed to.
Yeah.
Okay. Sort of like some sort of like go-to person for this.
Yes.
Thing. Okay.
Because I think a lot of it, like Sandra and I can do if we're aware of it, but it's just like we're seeing so many people that it just to keep someone on my radar and to continually check back in on them is just not possible.
Yeah.
You know what I mean?
Yeah.
So if you had someone whose job that kind of was,
I think
that would help.
Okay.
when I know that someone is having issues, like they're calling me all the time or something,
Yeah.
then I'm more than happy to like do whatever I can as a social worker or whatever, you know. But it just, unless you like scream out to me, I'm not gonna be able to keep you in the back of my mind all the time.
I totally understand.
If that makes sense.
It does. Okay. Thank you.
Mm-hmm.
Sorry that I had a gap in